Hello, everybody. My name is Mohan Sundararaj. I'm the Director of Public Health Programs at Impact Global Action for Gay Men's Health and Rights. I'm a physician from India and currently based in Oakland, California, with a background in global public health and gay men's health. I am, and so is my organization Impact, delighted to be invited by the IAPAC team for this important conversation that is being made possible through the Fast Track Cities conference that IAPAC is leading along with its partners. Impact is a nonprofit organization headquartered in Oakland. Our focus is gay men's health and rights, and we work in partnership with our collaborators to promote the health and rights of LGBTIQ people more broadly, as well as the health and rights of sex workers, people who use drugs, and people living with HIV. MPAC conducts high-level advocacy targeting major global agencies like the Global Fund, the United States President's Emergency Plan for AIDS Relief for PEPFAR, and the United Nations System, as well as advocacy targeting both donor and recipient country governments in partnership with the large global coalition of networks, organizations, and activists. We also deliver funding and technical assistance to local organizations at the country level. And over a period of 14 years, we have built a footprint in over 60 countries. Finally, we also conduct research, and our most recent Global Men's Health and Rights Survey was made available in 10 languages and attracted over 15,000 respondents from around the world, showing positive associations between health access and community engagement. You can learn more about us and our work by going to our website at impactglobal.org. The title of my presentation today is going to be Using Social Network Outreach to Mitigate Social Isolation Among Gay Men, Key Takeaways from Sexual Health. So this is just an overview of the presentation's objectives. So the first objective is to review issues linked to social isolation among gay men to come to a broad understanding of some of the dimensions of social isolation or the lenses that we would use to understand or approach social isolation as an issue among gay men. The second one is to identify key takeaways from case examples that I will present from sexual health, particularly around community mobilization. And thirdly, I will share a framework and some tips for deploying social network outreach strategies. One of the most obvious things that comes to mind when we're talking about social network outreach is defining target audience. So, who are men who have sex with men? Men who have sex with men are men who engage in sexual and/or romantic relations with other men, inclusive of the large variety of settings in which male-to-male sex takes place. This can happen across multiple motivations for engaging in consensual sex between adults, self-determined sexual and gender identities, and various identifications with any particular community. It is important to acknowledge and respect local terms used by men across diverse cultures and societies, such as gay or bisexual, through which men identify and affiliate in relation to their sexuality, sexual practice, and gender identity. I think we can all agree that empowered communities are best positioned to reach their members. It is important to remember that while gay men and other men who have sex with men have a range of shared sexual behaviors and attractions, they are also a very diverse community. Given these realities and diverse identities that gay men have, we recommend an open-minded, sensitive, and thoughtful consideration of what community might mean when conceptualizing interventions that are community-led for men who have sex with men around the world. I now want to cover some issues linked to social isolation among gay men. Gay and bisexual men do not have a predisposition to mental health illnesses solely on account of their sexual orientation, gender identity, gender expression, or sexual behaviors. However, the gay community can experience higher than average levels of social isolation as a result of external factors such as rejection or marginalization. Gay men may experience social isolation not only through such factors but also through the expectation of rejection from society or internalized homophobia, which we sometimes refer to as self-stigma. Homophobia and transphobia against gay and bisexual men, including transgender men who have sex with men, is well documented around the world, regardless of the environments these individuals live in. Homophobia and transphobia can also be manifested through structural factors such as punitive and exclusionary laws, discriminatory social and economic policies, or violations of human rights by states or societies. As a result, many gay men experience mental health challenges of varying kinds and degrees at some point in their lives. Gay men who do not feel safe with or trust their healthcare providers are less likely to discuss their mental health issues openly. So, in summary, the key messages here are that there is no innate association between homosexuality and mental pathology. Homophobia and discrimination can create stress and lead to other mental health challenges. And finally, poor mental health in the context of social isolation can lead to reduced health seeking behaviors. Age is another factor to keep in mind, as for older gay men, they are less likely to be partnered or married, more likely to live alone. And for adolescents, isolation is often compounded by the fear of coming out or being outed and the fear of rejection. Social isolation during the COVID pandemic is an important consideration for this topic. Gay and bisexual men who are already likely to be more socially isolated because of discrimination and homophobia are suffering disproportionately from the prolonged isolation from COVID. Anxiety and fear about restrictions on mobility and socializing is likely to be particularly acute for gay men. COVID also disrupts in-person delivery channels commonly used for mental health or sexual health or harm reduction prevention programs and care. That said, communities and programs from around the world have also seized the opportunity despite the harsh realities of COVID, in that we have looked for new ways of connecting with each other, especially leveraging technology, as well as to keep programs open and in very creative ways. This includes the ways in which gay men, though with some risk involved, are adapting their sexual lives to COVID by exploring the online space for sexual connection. Now I want to switch gears and talk about a few approaches that I am familiar with in sexual health programming that I think could apply when we think about social network outreach strategies to mitigate social isolation among gay men. A couple of the case examples that I'm about to talk about are part of a 7 case study compendium that was developed by Impact, and it's a publication that you can download from our website. And so if you have any questions or want greater detail about these case studies, you can refer to this publication. Here's a case example from Australia that speaks to a social marketing campaign to increase uptake and adherence for PrEP. It was led by the local organization ACON in partnership with the New South Wales government. So here's an excerpt from the campaign, which was launched in online platforms as well as public places, including online platforms like Facebook, Grindr, and others. Look at how simple and clear some of this messaging is and how you might think about messaging for a campaign designed to reduce social isolation among gay men. Here's a case study on Ukraine, which speaks to a sex-positive campaign also to increase uptake and retention in PrEP. In this case study from Ukraine that was led by Global Alliance, the gay organization in Ukraine, one of Impact's partners, Global Alliance used high-quality image-based messaging about PrEP in dating apps like Hornet and Grindr, or on their dedicated site for PrEP, as well as on Facebook. And these all were effective at raising awareness. There was also a deeper dialogue that happened as a result of a social networking approach that Global Alliance took mainly through Facebook, which allowed for more information to be posted and for a public dialogue about PrEP to be unfolding within these online platforms. And then finally, converting interest into action is also important in that the website that was dedicated for prep became the endpoint from the online tools that people can then go to and then indicate using a simple form about their interest in enrolling in prep and provide their contact information for staff to follow up on. So think about how you might deploy a campaign that could raise awareness about social isolation, instigate a deeper dialogue about mental health, and convert interest to action by linking people to resources that are easily accessible. Next, I want to talk about Kenya, a case example also within our prep case studies workbook that talks about a peer education model in the online setting to increase demand for prep. This case example features the work of our partner in Kenya, Ishtar, based in Nairobi, also a gay-led organization. And here again, I will let you go and read the case study in our case study workbook. But what I want to emphasize here is that in order to ensure that the peer leaders would bring optimal value to the support groups for PrEP, Ishtar established a set of criteria. The criteria allowed Ishtar to ensure quality and authenticity when communicating with support group participants. So the criteria for peer leadership were that the peer leader must be a PrEP user, for example. They must be willing to publicly discuss the experience of using PrEP and associated medical and lifestyle issues. They must have a substantial social network they can tap to expand the reach of the group. And they must have accurate information about PrEP and HIV services. Similarly, think about the use of peer leaders to help mitigate social isolation. For example, would they bring some experiences that gay men can relate to? Are they an online influencer with a substantial social network they can tap? And how can they get accurate information about some basic strategies for mitigating social isolation among gay men so that they can support the individuals they engage with? This next case example is taken from our partner Hornet, which is a social networking platform for gay and bisexual men worldwide and which has 25 million users. Hornet runs the Health Ambassadors program as a peer-to-peer engagement program. So the Hornet's Health Ambassador program is a feature that allows for peer-to-peer engagement around sexual health in the online community within the Hornet app. A health ambassador receives a badge in their profile indicating that they're willing to engage in a conversation around sexual health and share their lived experience. The badge is an invitation to chat with them about all sorts of topics that impact the health and wellness of gay men, including social isolation. The final case example I have for you is HIV 2020, which is an online event organized by Impact and its partners. HIV 2020 had over 2,000 registrants from 123 countries. There were 35 sessions that were shortlisted based on the proposals that we received from community and community stakeholders. The session attendance ranged from 100 to 3,200. So this level of attendance also speaks to the power of large online events that become safe spaces for community. But it also happened as a result of careful curation of content that was aligned with community priorities and the curation that was driven by communities themselves. Here you can see on the screen an example of our most well-attended session titled Our Gay Bodies, which explored body image, intimacy, and community support through kink. So now that we've gone through these case examples, what are some key takeaways that we could borrow from sexual health and apply to social network outreach strategies to mitigate social isolation among gay men? The first key takeaway is that virtual platforms like Facebook or Grindr or other social networking apps are an effective way to reach gay and bisexual men in rural as well as in urban settings. Secondly, sex-positive messaging and non-stigmatizing engagement approaches are key to reaching gay men. We did not talk a whole lot about this, but then if you refer to the PrEP case study workbook, there are different types of analytics that can help programs make the best use of their data. We also saw that the use of peer-led approaches is widely accepted as an effective model for acceptability of services. And this is also something that we can apply from the HIV and sexual health field. Secondly, capacity building of online peer educators is important because it can ensure the standardization and continuous improvement of services. And finally, just to reinforce that peer leaders can best serve the needs of target service users or gay men when their own realities and experiences are aligned with those of the community. I have more key takeaways for you, and one of them is that health promotion campaigns and delivery platforms must be properly vetted with gay men prior to implementation. A well executed campaign can actually inspire gay and bisexual men to discuss their health with providers, with their partners, as well as their friends. And also, the use of multiple channels to mobilize gay men may be necessary to bring an intervention to scale in the community. So, if we are just looking at one channel, it may not really maximize or optimize the reach. We also saw that health ambassadors within online communities can serve as sources of knowledge, connection, and empowerment. And these online influencers can serve to build the skills and capacity of gay men to have more agency as they navigate their health, in this case, mental health. And engagement doesn't have to be limited to the online space, and especially because access to technology is not a given for gay men around the world, we also want to try to expand those offerings to in person community meetings as and when we can. Finally, we learned that online events are a great way to create a safe space for gay men to connect with each other and to build community. And in that, what becomes really important is that we're listening to community and taking their cues to create content that's aligned with their priorities. And we do so in a continuous manner so that as priorities are evolving for communities, we are also evolving our programming opportunities and options. And in that, quality assurance becomes really important to ensure retention as well as sustainability of these programs. I think when we talk about social outreach network, especially online, it's important to talk about digital security. And there are many important reasons why gay men might use the internet, including communication, networking, self expression, visibility, as well as sexual and social connection. And so the use of digital and information technology can put gay men at risk. And so it's important that we remind ourselves as well as our communities about the importance of digital safety and security. And so I've included here a link to the activist guide to digital security that MPAC developed a few months ago, which also has a short video that I think you would find useful. When it comes to creating an outreach campaign, there is no formulaic approach to do it in a single way. It really depends on the context you're in and what your goals of the campaign are. But here are some tips for you to think about as you build your campaign. Take a social media post, for example. You want to make sure that it has strong messaging and good imagery to excite and energize gay men. You also want to tailor your social media posts depending on the channel you use, be it Twitter, Facebook, Instagram, or other social networking platforms online. And you also want to think about next steps. Will they click a link to go somewhere? Is there going to be a hashtag that would create a buzz around your social media posts? Is it shareable so that people can use that content and do something with it? And is there a way to contact you? And most important in all of this is to keep in mind the needs of your audience and what they would like to see in a social media post around the issue that you care about and they care about. So, in developing a social network outreach campaign, you want to think about creative content, a clear message, thinking about tailoring those messages to the social media channel that you will be deploying the message through, thinking about what are some clear next steps that people can be guided towards, and then most importantly, really connecting with your desired target audience. Here's just a list of questions that you should be thinking about as you imagine a social network outreach campaign. For example, who is your target audience? What do you want them to do? Where are they online? What are your key messages? And what content can we create that would excite and energize them? And as you run your campaign, it's also important to be critically reflective and to ask this question of, is this campaign effective? And that's basically pointing to what are people responding to. And based on what you find out, you might realize that you will need to adjust your campaign or course correct, and you might have to let go of some exciting imagery that you might have been excited about, but it's not really being effective with your target audience. And so that kind of course correction and critical reflection is also important as we roll out social network outreach campaigns. Here's just a broad range of tools for engagement that you could pick and choose from depending on your individual context and depending on your individual need. Finally, before I close, I wanted to just present a framework that I think is one of the most important lessons we could really apply from HIV and sexual health in imagining and delivering social network outreach interventions targeting gay men, in that powerful communities have always been the backbone of the HIV response for 30 years. And in that regard, community empowerment is also linked to a broader social movement that supports the self-determination of gay men. And so investing in community empowerment is really critical to achieving impact, because choice, control, and community integration and access to essential services produce positive health outcomes. So what does the community empowerment framework for gay men mean, and what does it also mean to apply a community empowerment framework in the design and rollout of interventions for gay men? And so it really means that we are really paying close attention to the need for gay men to come together for affirmation, mutual assistance, and support by addressing individual and community needs in a supportive and safe environment. Applying this framework means that we're facilitating connectedness and affinity with others who share similar experiences around sexuality and gender expression. It also means being sex positive, which means that we really affirm sex and we celebrate sex, and we're non-judgmental about the sex and the types of sex that gay men want to have. And that includes sexuality and gender expression. It also means we are respecting each individual's self-determination and control of their own body. It means that we're meaningfully and respecting the engagement of gay men in all aspects of program design, implementation, and evaluation, really creating opportunities for their participation and leadership. It also means that we acknowledge and that we use the strengths and abilities of gay men as individuals and communities, recognizing and leveraging their diversity. And all this implies that we're also trusting gay men to know best how to identify their priorities, and also to identify the context appropriate strategies to address those priorities. It also means that we strengthen partnerships among communities and groups of gay men, as well as with outside stakeholders that they interact with, and that we're facilitating those partnerships. And last but not least, it also means that we're promoting and supporting the mobilization of financial, technical, and other resources for interventions to run well-resourced. One of the best resources for really understanding community empowerment frameworks with gay men is the MSM Implementation Toolkit, in which the first chapter is titled Community Empowerment. And this diagram that you see here is taken from that guidance document, and it really talks to the key elements of community empowerment among gay men. And so the process of community empowerment is by definition driven by gay men themselves. And so it is really impossible to adopt a prescriptive and inflexible approach to implement community empowerment initiatives. And so some of these elements could be guiding principles or guiding strategies for how you might think about community empowerment when you also think about social network outreach strategies targeting gay men. And this approach is, of course, not a rigid approach. It's flexible and adaptable, and there is no order in which these elements need to be addressed, as long as we're using them to really continuously inform the actions we take when we engage with gay men. I just want to take a moment to thank my colleagues at MPACT for their support in this presentation, in particular Johnny Tomei, Greg Tetaglione, and Dr. George Ayala. So that brings me to the end of my presentation today. I appreciate you for taking the time to listen to my presentation. I hope you found it useful, and I hope that you will use some of what we went through today in my presentation in your work. And if you do that, or if you have any questions or comments, I'd love to hear from you. So I've listed my personal work email address at the top, as well as the organization's general email address at the bottom. So I look forward to hearing from you, and I also want to take this opportunity to thank the IAPAC team one more time for putting together a really impressive program for the Fast Track Cities Conference, and I wish you a very good day and a great conference. Thank you.